HIV, human immunodeficiency virus, is a retrovirus that attacks the immune system by targeting and destroying CD4+ T lymphocytes, a type of white blood cell that plays a key role in immune responses. The reduction in these cells makes the body susceptible to opportunistic infections and malignancies. AIDS, acquired immunodeficiency syndrome, is the advanced clinical stage of HIV infection, characterized by severe immunosuppression. Without treatment, HIV typically progresses to AIDS within an average of 10 years, but this depends on the individual patient's characteristics. HIV biological characteristics. HIV belongs to the Retroviridae family and the lentivirus subgroup, indicating a slow progressive effect on the body. Genetic structure. The virus contains 2 copies of single-stranded RNA, which is converted into DNA with the help of the reverse transcriptase enzyme. Key viral proteins. GP120 and GP41, proteins that allow the virus to attach to and penetrate CD4+ cells. Reverse transcriptase, an enzyme responsible for converting viral RNA into DNA. Integrase, embeds the viral DNA into the genome of infected cells. Protease, involved in creating new viral particles. Transmission mechanisms. The main routes of HIV transmission include sexual contact. The virus is present in semen, vaginal, and rectal fluids. Unprotected anal sex poses the highest risk due to the fragility of the mucosa. Blood and blood products. Transmission can occur through shared needles, unsterile medical instruments, or transfusions of infected blood, now rare in developed countries. Vertical transmission, from mother to child during pregnancy, childbirth, or breastfeeding if antiretroviral prophylaxis is not applied. Risk factors. Coexisting infections such as gonorrhea, syphilis, or herpes. Damaged mucosa, e.g., wounds or inflammation. Progression of HIV infection. HIV progresses through the following stages. Acute infection, first 2 to 4 weeks. Rapid viral replication with high concentrations in the blood. Symptoms: fever, pharyngitis, lymphadenopathy, muscle pain, rash. However, the infection can often be asymptomatic. Latent period. Last years without significant symptoms, though the virus continues to destroy CD4+ cells. AIDS. CD4+ cell count falls below 200 L, normal 500 L. Opportunistic infections and malignancies develop, such as pneumocystis pneumonia, cryptococcal meningitis, Kaposi's sarcoma, tuberculosis. HIV diagnosis. Serological tests. ELISA, enzyme-linked immunosorbent assay, detects antibodies against HIV. Western blot confirms the presence of antibodies. Molecular tests. PCR, a polymerase chain reaction, measures viral RNA in the blood, crucial for early diagnosis. Rapid tests. Provide results within 20 to 30 minutes using a drop of blood or saliva. Monitoring. CD4+ cell count reflects immune system damage. Viral load, the amount of HIV in the blood, measured in copies ml. Treatment. Antiretroviral therapy, ART. ART is the standard treatment for HIV, involving a combination of drugs targeting different stages of the virus's life cycle. Main classes of medications. Reverse transcriptase inhibitors. Nucleoside, NRTI-zidovudine, lamivudine. Non-nucleoside, NNRTI efavirenz. Protease inhibitors, PI ritonavir, lopinavir. Integrase inhibitors, raltegravir. Fusion inhibitors, enfuvirtide. Effects of ART. Suppresses viral replication to undetectable levels. Restores CD4+ cell count. Reduces the risk of transmission by up to 96%. Prevention. Medical prevention strategies. PrEP, pre-exposure prophylaxis, preventative medication for high-risk groups, e.g., partners of HIV-positive individuals. PEP, post-exposure prophylaxis therapy initiated within 72 hours after potential HIV exposure. Safe medical procedures. Use of sterile needles and instruments. Prevention during sexual contacts. Prevention during sexual contacts. Prevention during sexual contact is a key element in fighting the spread of HIV. It includes several main approaches. Condom use. Effectiveness. Condoms are the most effective way to prevent HIV and other sexually transmitted infections, STIs, when used correctly for every sexual contact. Types of condoms. Male condoms, latex, polyurethane. Female condoms, less commonly used, but also effective. Common mistakes, incorrect placement, using expired condoms, or storing in adverse conditions, heat, direct sunlight. Limiting the number of sexual partners. Reducing the number of sexual partners significantly lowers the risk of contact with an infected person. Long-term monogamous relationships with an HIV-negative partner are an effective prevention strategy. Regular testing. Sexually active people, especially those in high-risk groups, should be tested for HIV and other STIs at least once a year. Testing before starting a new relationship can provide reassurance for both partners. Preventive therapy, PrEP, pre-exposure prophylaxis recommended for those at risk, such as individuals with HIV-positive sexual partners, those who frequently have unprotected sex, members of high-risk sexual communities, e.g., men who have sex with men. PrEP is taken daily under medical supervision. PEP, post-exposure prophylaxis initiated within 72 hours after possible exposure to HIV, e.g., after unprotected sex with an unknown HIV status partner. Therapy lasts 28 days. Lubricants. Using lubricants, water-based or silicone-based, can reduce the risk of condom breakage or mucosal injury, particularly during anal sex. Vaccines and treatment of other STIs. Treating sexually transmitted infections like syphilis, gonorrhea, and chlamydia promptly is crucial, as the presence of other STIs increases the risk of HIV infection. Vaccines against hepatitis B and human papillomavirus, HPV, also play a role in sexual health. Avoiding alcohol and drugs. Alcohol and drug use before or during sex can lead to risky decisions, such as not using a condom. Education and communication. Conducting educational programs aimed at young people to understand the risks and ways to prevent HIV. Honest and open communication between partners about their sexual and health status. Conclusion. HIV and AIDS are global health challenges requiring both scientific and social approaches. Advances in medicine, especially in antiretroviral therapy, enable people living with HIV to lead long and fulfilling lives. However, fighting the spread of the virus remains our shared responsibility. Key steps in this fight include early diagnosis through regular testing, antiretroviral treatment, which not only saves lives but also reduces the risk of virus transmission, effective prevention based on awareness, safe practices, and access to preventive measures such as PrEP and PEP, reducing stigma and discrimination through education and support for those affected. Each of us has a role as individuals, professionals, or community members to contribute to awareness, compassion, and active participation in efforts to curb HIV.